As you know, overall patient health and well-being depends on what happens outside your office. But with an overload of patients, demanding insurance companies, and not enough hours in the day, how can a physician provide the care patients need in between visits? That's where Ascent Care Partners can help. We become an extension of your office and provide virtual care services to your Medicare patients. The primary services we provide focus on chronic care management and remote patient monitoring services. RPM and CCM are Medicare reimbursed virtual services that your patient receives right in their homes. RPM and CCM are complementary services and can be billed in the same month. These services leverage digital technologies to easily connect people and important healthcare devices together. Physicians like the service because it's cost-effective, delivers positive outcomes, and compensates physicians for the work they often do in between visits. Patients like it because it helps them play an active role in managing their conditions, learn more about health issues they face, and get answers to questions they have before and after office visits. Medicare patients with one or more qualifying chronic conditions are eligible to participate in remote patient monitoring services. RPM is interactive virtual care and remote monitoring of a patient's physiological parameters. With RPM, we can monitor weight, blood pressure, pulse oximetry, temperature, or blood glucose. Once the patient signs up, we ship the equipment directly to their home. There's no setup and nothing to plug in. The patient just inserts the supplied batteries and starts taking readings. Each time they use the device, it will send the data over a cellular network to our secure RPM portal. If there's a reading outside of normal limits, the system sends an alert to our team, and we determine the best course of action based on instructions you provide during setup. There's also a personal component. We call the patient at least once a month to discuss their data and health conditions. These are referred to as care calls. The information from the care call is compiled into an easy-to-read report each month and sent to you. You'll learn about changes in patient health conditions quickly without the patient visiting or calling the office. RPM delivers the care your patients need right in their homes while giving you additional flexibility to accommodate more patients in the office and recognize significant revenue for patients who are not in the office. Medicare patients with at least 2 chronic conditions are eligible to participate in chronic care management care calls. Following the RPM care call, the care coach will discuss health conditions, medications, upcoming appointments, or any changes in health along with providing patient education. We help the patient with their questions or concerns, then summarize everything in an easy-to-read report that we send to you. These services help patients self-manage their chronic conditions, continue living in their own homes, reduces calls to your office, and reduces trips to the hospital and ER. Patients look forward to receiving a call from their personal care coach each month. This consistency results in a bond between the two and a better understanding of changes in the patient's condition. Physicians like CCM because it lets them see changes in the patient's health early and be proactive to keep them out of the hospital. With CCM, ACP becomes an extension of your office and a conduit to your patients in between office visits. Our high-tech and high-touch approach to virtual care helps you achieve improved patient outcomes at lower costs. RPM and CCM deliver great care, but also bring steady revenue into your practice with zero risk. We compile billing information each month and share that with you so you can focus on running your practice. To make sure you are always cash flow positive, we don't send you an invoice until after you've had a chance to drop charges. How substantial is the revenue? A typical practice with 300 participating patients will earn between $165,000 to $210,000 per year in net revenue. Ready to get started? Just click the link below to schedule a meeting with us to answer any questions and discuss how ACP can work with you.